Chapter 15, Calculations for Preparation of Intravenous Infusions. Intravenous IV medications require precise measurements and sterile preparation because the medication immediately enters the bloodstream with 100% bioavailability. Hospital pharmacy technicians usually prepare and deliver a 24-hour supply of IV solutions to nursing stations. Large volume parenterals contain more than 250 mLs of solution, whereas small volume parenterals contain 250 ml or less. LVPs, large volume parenterals for continuous infusion with or without added medications, drip slowly into a vein either by gravity or through a pump. An IV infusion set includes tubing for carrying fluid from the container to the patient. Medication added to a small volume of fluids called an IV piggyback is administered on an intermittent basis, either through an injection port in the tubing or another line. Most IV PBs are SVPs that are delivered over 30 to 60 minutes. The physician determines the type and volume of IV fluids, whether medications are added, and the amount of time over which they should be administered. Parenteral nutrition is an IV that provides patients' nutritional needs via infusion. It is generally prescribed when a patient is unable to ingest and process nutrients orally. It can be used to maintain nutritional needs on a short-term or long-term basis. Standardized PN solutions are available, but they can also be customized to meet individual nutritional requirements. Because of the regulations that surround the compounding of parenteral solutions, many pharmacies and hospitals contract out their PN orders to compounding companies that specialize in this area. Familiarization with the basic calculations necessary to fill such an order is still important. And then here in figure 15.1, we have the intravenous piggyback being added to a primary line. And preparing large and small volume parenterals. Physicians frequently order LVPs and SVPs with additives. All right, and let's do example 15.1. Example 15.1, a physician orders ampicillin 0.2 grams per kilogram per day IV to be delivered in divided doses every 6 hours for a 110-pound patient. The physician wants each dose placed in 500 ml of 5% dextrose. How many milligrams are needed per dose? The first thing we want to do is calculate the patient's weight in kilograms. And if the patient weighs 110 pounds, how many kilograms is that? So we're going to use our conversion factor of 1 kilogram is equal to 2.2 pounds. And then I'm going to plug in my known variables where they're going to go. The patient weighs 110 pounds. How many kilograms is that? So then that's 2.2x is equal to 1 times 110, which we know is 110. We want to get x alone. So we're going to divide each side by 2.2. We're going to get out our calculator. And do 110 divided by 2.2, which gives us that x is equal to 50 kilograms. And now we can figure out the dose by doing the 0.2 grams per kilogram. And we place the 50 kilograms here. How many grams are we going to give based on the weight? So we have x, 1x, which is just x, and then we have 0.2 times 50. So 50 times 0.2 is 10. Okay, now that we found out that we need 10 grams, remember that it says that we're going to do it in divided doses every 6 hours. And we know that every 6 hours is 4 times a day by dividing 24 by 6. So we're going to take that 10 grams and we're going to divide it by 4 doses. 10 divided by 4 is 2.5. So we need to give 2.5 gram per dose. But remember, the problem says milligrams, so we need to convert using our conversion factor of 1 gram equals 1,000 milligrams, which by now you should know. And we want to find out how many milligrams that is. So that would be 1x is equal to 2.5 times 1,000. And that's just x is equal to 2.5 times 1,000, which gives us 2,500 milligrams. The next part says 2 grams of ampicillin for injection are available to be reconstituted with 6.8 milliliters of sterile water, resulting in 8 milliliters of fluid. How many milliliters need to be added to each IV? So we're going to look at this 2 grams, and we know that 1 gram is equal to 1,000 milligrams, right? So if we have 2 grams, that's going to be equal to 2,000 milligrams. So after we take the 2-gram powder vial and mix it with 6.8 ml of water, the strength of that vial is now 2 grams over 8 ml, but 2 grams is 2,000 milligrams. So it's really 2,000 milligrams over 8 ml. And what do we need to put in? 2,500 milligrams. How many ml do we need? So we have 2,000x is equal to 2,500 times 8. So we would first take care of our multiplication side. So 2,500 times 8, which is 20,000. And we still have 2,000x over here. We want to get x alone, so we need to get rid of this 2,000. And we need to divide by this side as well. So 20,000 divided by 2,000, it gives us that we need to add 10 ml. The next part says, how many milliliters of fluids will a patient receive daily? So let's go back up to our problem. And remember, they're getting 500 ml IV bags. And it's not just 500 ml anymore because remember, we have added 10 ml of the medication. So now we have 500 ml plus 10 ml. So we have 510 ml. And remember, they're doing this 4 times a day. So 510 times 4 is 2,040 ml. Example 15.2, a physician orders an insulin infusion of Humulin R 50 units in 1,000 ml of normal saline. So we're putting this in a 1,000 ml normal saline, 0.9% sodium chloride solution. So we have this label here. So remember, U100 means that there is 100 units per 1 ml of the insulin. So I'm going to put that into one side of a proportion. And the doctor has ordered 50 units, so that's going to go up here. And this is where my X will be. So 100X is equal to 50 times, ooh, move that wrong, 50 times 1, which is 50. And we want to get X alone. So we need to divide each side by that 100. Oops, 50 divided by 100 is 0.5 ml. So we're going to remove 0.5 ml from that insulin vial and place that into the 1000 ml IV bag of sodium chloride. A rate is a volume per unit of time. An infusion or flow rate refers to the amount of IV fluid entering the body over a specific amount of time. It may be expressed in terms of milliliters per minute, milliliters per hour, an amount of drug, micrograms, milligrams, grams, units, or milliequivalents per minute or hour, or drops per minute. The reason for therapy dictates the type of fluid and rate of infusion ordered. Fluids given to keep a vein open are given slowly, whereas replacement fluids are given at a rate that will provide the necessary fluids while preventing an overload on the vascular system. The pharmacy technician must be able to calculate how long a particular volume of fluid will run in order to calculate how much longer a currently hanging IV solution will last and when the next IV is due. This ultimately will determine the amount of IV solution to be prepared for a 24-hour period. Calculations with IV infusion rates can be used to determine the following. The amount of medication delivered over a specific period of time, the volume of medication delivered over a specific period of time, dose volume, the volume of medication needed to last a specific amount of time, the length of time a medication dose will last, dose time. And each of these problems can be solved using DA, which we're not going to do, or ratio and proportion. And I suggest ratio and proportion because that is the form we will use in this program. And let's do example 15.3. Example 15.3, how much fluid will a patient receive in 5 hours at an infusion rate of 125 ml per hour? So for our proportion, we already have our first conversion factor, which is 125 ml per hour. And we're going to need ml up here and hours down here. And we have 5 hours. How many ml over those 5 hours? So we would do 1x, which is just x, is equal to 125 times 5, which gives us that it is 625 ml over 5 hours. Example 15.4, what is the infusion rate in milliliters per hour of 1000 ml IV to run over 8 hours? So we know that our infusion rate is volume over time. And our volume is 1000 ml, and our time is 8 hours. So we would just do 1000 divided by 8, which gives us 125 milliliters per hour. Example 15.5, what is the infusion rate in milliliters per minute of a 1500 ml IV to run over 12 hours? So we can first do our minutes, or we can do it later. It will just be easier if we do it now. So we can do a conversion factor of using 1 hour is equal to 60 minutes. And doing 1 hour, 60 minutes, and then plugging in our 12 hours. To find out how many. So we can go through all of this and do it just like we normally do, and we would just simply just be multiplying 60 times 12. So the amount of hours times 60 for minutes, which is going to give us 720 minutes. So now we can just do 1500 ml over 720 minutes. So 1500 divided by 720 gives us 2.08, which we would round to 2 milliliters per minute. Example 15.6, how long would 1000 ml IV last at 50 ml per hour? So we have our conversion factor for one side of 50 ml over 1 hour. And we put hours here and ml here. We have 1000 ml. We want to know how long that will last. So we'll put our x underneath, and now we have 50x is equal to 1000 times 1, which is just 1000. We want to get x alone. So we need to divide that 1000 by 50. And we get 20 hours. All right, so the first thing we're going to do is we're going to take out that 100 ml over 1 hour. And then we need to do a proportion. So we know we need milliliters over here and hours over here. And we have that we're giving the patient 10,000 units per liter. So we know that a liter is 1,000 milliliters. And we need to find out how many hours that is. This is just supposed to be X hours. So we have 100X is equal to 1,000 times 1, which is 1,000. We want to get rid of a 100, so we need to divide each side by 100, which leaves us with X is equal to 10 hours. And then our next part says how many units will be delivered per hour. So we're looking for 8 units over 1 hour. And we know that they are doing those 10,000 units over 10 hours. So we have 10x is equal to 10,000 times 1, which is 10,000. We want to get x alone, so we're going to divide each side by the 10. So our 10,000 divided by 10. So now we found out that we're going to give 1,000 units per hour. Calculations can also be made to determine how much medication a patient has received at a particular point in their therapy in case the IV is discontinued or infiltrates and must be stopped before it is completely finished. And with that, let's do example 15.8. Example 15.8, 1 liter of IV of D5W with 80 milliequivalents of potassium chloride. KCl was discontinued after 650 ml of the fluid infused. How many milliequivalents of KCl did the patient receive? So we're going to take our 1 ml. We know that's 1,000 ml. So there's 80 MEQ in 1,000 ml that was given to the patient. And the patient received 650 ml. How many MEQ did they receive? So that's 1,000x is equal to 8 times 650. So 650 times 8 is 5,200. And we still have 1,000 over here. We want to get x alone, so we need to get rid of this 1,000. Then we also would have to divide this side by 1,000, which gives us that x is equal to 52 milliequivalents. A drip rate, sometimes called a drop rate, represents the number of drops administered over a specific time via IV infusion. It is a specific type of infusion or flow rate measured in drops per minute. The calculation of drip rate is affected by the size of the tubing used to deliver the medication. A drop factor, which is in drops per milliliter, is found on each tubing package. Various drop factors are available. 10, 15, and 20 drop per ml are macro drip tubing sets, whereas 60 drops per ml is considered a micro drip tubing set because the drops are much smaller. Think of 1 ml divided into 60 drops. Although it is very rare for a pharmacy technician to have to calculate drip rates, it is still an important skill to know. A physician order provides the type and amount of fluids and is usually a desired infusion rate or infusion time. The proper infusion set must be chosen to supply the fluids as ordered. 4 factors to be considered with administration rate are the total amount of fluids to be administered in milliliters, the calibration of the administration infusion set, in drops per milliliter, the flow rate of the fluids in drops per minute, the time for the fluids to infuse in minutes. Figure 15.2 shows infusion sets for administration of intravenous fluids. Figure A is a macro drip set that shows 10 drops per ml, and B is a micro drip set that shows 60 drops per ml. And let's do example 15.9. All right, example 15.9. This one's a little trickier than some of the other ones. So we have a physician orders Pepsid famotidine 20 milligrams and a total of 50 milliliters of normal saline to run over 25 minutes. Calculate the drops per minute if the drop factor is 20 drops per ml. So the first thing we're going to do is use the conversion factor. And this has nothing to do with this here of 20 drops is equal to 1 ml. And since the problem wants to know drops per minute, I am going to plug in this 50 ml here that we're giving them total. And I want to find out how many drops that is. So I have 1x, which is x is equal to 20 times 50. Get out my calculator and do 20 times 50, and that is x is equal to 1,000 drops. So we know that we want our final answer to be in drops per minute. So drops per minute. And that's going to be 1 minute. So this is going to be ultimately what we're looking for. And we have our 1,000 drops that we just calculated. And we have 25 minutes that it lasted. So now I'll just do 25x is equal to 1,000 times 1, which is just 1,000. I want to get X alone. So I need to get rid of that 25 there. And I can divide each side by 25, canceling that out. And then I have 1,000 divided by 25 over here, and that gives me 40 drops per minute. Example 1510, a physician orders 3 liters of D5W to run over 24 hours. If the drop factor is 20 drops per ml, what is the drip rate? So remember, our drip rate problems are going to be volume over time times the drop factor. And our volume should be in milliliters, and our time for these is in minutes. So we have 3 liters. We need to convert that to milliliters. And remember, if 1 liter equals 1,000 milliliters, then 3 liters is equal to 3,000 milliliters. And then we need to convert the 24 hours to minutes. And we can simply do that by taking the 24 and multiplying it by 60. Or we can also set up a proportion like I showed you earlier. If we do the multiplication for that, it's 1,440 minutes. And then now we can just plug our information in. So we have our volume being the 3,000 milliliters, our time being the 1,440 minutes, the drop factor being 20 drops per ml. And now we just get out our calculator and we do 3,000 divided by 1,440 times 20. And we get 41.67, which we'll round up to 42 drops per minute. And how we get our units of drops per minute at the end, we have 2 milliliters here in this problem, so those cancel out and we're left with only drops in minutes. In some instances, the physician will provide an order for the amount of fluids to be infused in the milliliters per hour without providing the specific infusion time. The problem then becomes a question of how long it will take for each volume of fluid to be infused using the rate ordered by the physician. As the pharmacy technician, you have a responsibility to ensure that fluids are available for the next dose as ordered. Therefore, when the time is not designated, but the amount is designated, the necessary calculation may include deciding how long the ordered fluids will take to infuse when the infusion rate and or drop factor is provided. And then let's do example 15.11. Example 1511. The order is for 250 ml LR lactated ringers to be infused at 50 drops per minute with an infusion set of 10 drops per ml. What is the infusion time per minute? Time in minutes. So we're first going to take that 10 drops per ml. It's 10 drops over 1 ml, and we need to find out how many drops our 250 ml is to do this problem. So we have 1x, so that's just x, and then we have 10 times 250. If we do 10 times 250, that is 2,500, and that's 2,500 drops. And then we're going to use our infusion rate of 50 drops over 1 minute. And we're going to plug in those 2,500 drops to find out how many minutes it's going to take to infuse this. So we have 50x is equal to 2,500 times 1, which is just 2,500. We want to get x alone. So we divide by 50 here, that cancels out, and then we gotta divide by 50 here. So we have 2,500 divided by 50, which gives us 50 minutes. Example 1512, the order is for 2,500 ml of D5NS to infuse at 30 drops per minute with an infusion set of 10 drops per ml. How many minutes will it take for these fluids to infuse? So we're going to do kind of the same thing we did in the last example and do 10 drops over 1 ml. And then we're going to plug in the 2500 ml to find out how many drops that is. So we have 1x. X is equal to 10 times 2500. Which gives us 25,000 drops. And then we're going to take our 30 drops over 1 minute, plug in our 25,000 drops to find out how many minutes that is. So we're going to go diagonally and get 30x, and then diagonally and get is equal to 25,000 times 1, which is just 25,000. We want to get x alone, so we're going to divide each side by the 30. And that gives us that x is equal to 833 minutes. A physician orders amphotericin B 40 milligrams IV PB, IV piggyback, and D5W 250 ml. Infuse at a rate of 20 drops per minute with a drop factor of 60 drops per ml. When reconstituted, the amphotericin is 50 milligrams per 10 ml. How many milliliters of amphotericin B should be added to the fluids? So they want the patient to get 40 milligrams, and after we reconstitute it, it's 50 milligrams over 10 ml. So this is just a problem like we've been doing. Plug in my 40 milligrams here and leave my X there. And I would do 50x is equal to 40 times 10, which is 400. We have 50x. We want to get x alone. We're going to divide each side by 50. So we have 400 divided by 50, which gives us 8 ml. That's how much we would add to the fluids. All right, the next part, it says, what is the total volume to be infused? I don't have that on here, but it is in the example. So we would take our 250 ml. And we would add our 8 ml. And we would infuse 258 ml. We have an order for vancomycin IV piggyback 1 gram and 100 ml of D5W. The drop factor is 20 drops per ml, and the infusion rate is 1.5 milliliters per minute. Vancomycin is reconstituted to 500 milligrams over 10 ml. How many milliliters of vancomycin solution should be added to the 100 ml piggyback fluid? So they want 1 gram. Remember, 1 gram is equal to 1,000 milligrams. And we have the strength of that reconstituted to 500 milligrams over 10 ml. And we have 1,000 milligrams. So we'd have 500x is equal to 1,000 times 10. Which is 10,000. And we have 500x. We want to get x alone, so we need to divide each side by 500. So 10,000 divided by 500 gives us X is equal to 20 ml. The total to be infused would be the 100 ml plus the 20 ml, which would be 120 ml. Traditional 2-in-1 parenteral nutrition supplementation includes base solutions of 2 essential macronutrients, which are dextrose, carbohydrates, and amino acids, protein, along with electrolytes, vitamins, trace elements, and water. A stable IV lipid fat emulsion, IVFE, is included in some formulations, resulting in what is called a 3-in-1 formulation, which includes 3 macronutrients: carbohydrates, protein, and fats. In addition, PN solutions can contain medications such as regular insulin and others as needed and indicated given the patient's clinical situation. PN can be administered via either central or peripheral lines, with central lines often placed in the superior vena cava and peripheral lines inserted into the veins of the arm or hand. Peripheral parenteral nutrition must be lower in strength than total parenteral nutrition. TPN is administered through larger central lines where the solution is diluted in the bloodstream quickly. Peripheral vessels are smaller, so the solution is not diluted in the bloodstream as quickly. Chronic PN can even be administered and managed by patients in the ambulatory setting. 2 types of calculations are used to determine the contents of a PN solution. The first involves determination of the amount of base solutions, dextrose, amino acids, and lipids. The second involves calculations of the amount of additives such as electrolytes and medications to be included. When calculating the amount of stock solutions to use to obtain the appropriate strength of base solution ordered, the dilution equation may be used. And then let's do example 15.15. Example 15.15, we have an order for 1 liter of TPN solution containing 2.125% of amino acids and 25% dextrose. In stock are 8.5% amino acids, 50% dextrose, and sterile water for injection. Calculate the volumes of each solution needed to prepare the desired concentration, then QS with sterile water for injection to 1,000 ml. So for this one, we're actually going to use our dilution problems of SV times SS equals DV times DS. So first for the amino acids, and I'm going to put my variables over here on the side. So my stock strength is this 8.5%. My desired volume is the 1 liter, which we know is 1,000 ml. And my desired strength is going to be that 2.125%. So it's going to be my unknown. And then I'm just going to plug in my information. And then I want to do my side with my multiplication first. So 1,000 times 2.125, which gives us 2,125. Now we want to get SV alone, so we need to get rid of this 8.5. We'll divide over here. We now have SV alone, and we need to divide that by 8.5. So 2,125 divided by 8.5 gives us 250 ml of amino acids needed. And then we are going to go ahead and figure out the same thing for the dextrose. So I'm going to do SV times SS equals DV times DS. And I'll do my variables over here. And remember, my desired volume is still that 1,000 ml. My desired strength is going to be the order of 25%. And in stock, we have 50%. And we don't know what SV is. And we'll just plug in our information. So now we're going to do 1,000 times 25, which gives us 25,000. And we want to get SV alone, so we need to get rid of this 50. So we'll divide both sides by 50, which is going to give me 500 ml. Then the last part says a QS to 1,000 ml. So we need the final concentration to be 1,000 ml, and we are putting in 250 ml. So that leaves us with 750 ml. And then we're putting in the 500 ml from, this is the dextrose, this is the amino acids, and that's 250 mLs of sterile water for injection. An order calls for the following to be added to a standard 1 liter TPN solution that contains 50% dextrose, 10% amino acids, and 20% fat. Calculate the amount of each additive needed. So we have the additive orders, and then we have the available stock strength. So we're just going to be doing proportions for each one. So we'll do the sodium chloride first. We have the stock strength of 50 MEQ over 20 ml. And we need to give them 30 MEQ. How many ml? And then we do 50x is equal to 30 times 20. 30 times 20 is 600. And then we want to get x alone, so we need to divide each side by 50. So 600 divided by 50 is 12 ml. And then we're going to do that for all of these. So next I'll do the potassium acetate, and that is 40 MEQ over 20 ml. And we want to give the patient 15 MEQ. How many ml is that? So then we have 40x is equal to 15 times 20. 15 times 20 is 300. And then we have 40x is equal to 300. Oops. And we want to get x alone, so we're going to divide each side by 40. We're left with x there. And 300 divided by 40 is 7.5 ml. All right, let's do the potassium chloride. So the strength of that is 30 MEQ over 15 ml, and we want to give the patient 25 MEQ. How many ml do we need? So 30x is equal to 25 times 15. 25 times 15 is 375. So we have 30x is equal to 375. We want to get x alone. So we're going to divide each side by that 30. So 375 divided by 30 gives us 12.5 ml that we need for our potassium chloride. Next, we have calcium gluconate. We need to give the patient 9.4 ml, or sorry, 9.4 MEQ, and this is the strength. So we have 4.7 MEQ over 10 ml. And just mind you, I could put this on this side if I wanted. I would still get the same answer because they're equal to each other. So it doesn't matter which side you place the X on or the strength. So we need 9.4 MEQ. How many ml is that? So then we would just do 4.7x is equal to 9.4 times 10. We do our 9.4 times 10, which gives us 94. We want to get x alone. So we're going to divide each side by 4.7, which gives us 20 ml. All right. The last thing we have is regular insulin, 10 units. And we have that the strength is 100 units, is U100, which is 100 units per ml, which is also 1,000 units per 10 ml. It's the same thing. We get the same answer no matter what we use. So let's use 100 units over 1 ml. That's the strength. And we want to provide the patient with 10 units. How many ml is that? So we'll do 100x is equal to 10 times 1, which is 10. We want to get x alone, so we're going to divide each side by 100. So when we do 10 divided by 100, we get 0.1 ml. The pharmacy is responsible for providing the medications and fluids to fill physicians' medication orders. In addition, the pharmacy is responsible for ensuring that adequate amounts of fluids are provided for the desired length of therapy. Furthermore, you may be asked to calculate the amount of time that a container of fluids will last, the necessary volume of fluids, or the rate of infusion per minute or hour to provide the medication as ordered. Patient safety is ensured when the correct fluids ordered by the physician are calculated for the correct infusion rate. Because of the immediate action of medications administered through an IV route, the pharmacy must take extreme care with the calculations and the sterility and preparation. As a pharmacy technician, you must be sure the correct fluids are chosen along with correct medications. Rechecking calculations always enhances patient safety.